He literally removes your belly button to make his own because they look better.
It's better.
Yeah.
It's better than what God gave you.
Yeah. When I first started doing tummy tucks, a lot of people would come in asking, and this is just my personal thing, and I don't know what you do, but I would do mini tummy tucks, and I think there are some patients that are good candidates for a mini. But sometimes when we're doing those, we have to float the belly button, right? And we're always trying to gauge, like, okay, is this going to go down too far? Is this, in our zone of like looks normal, or is it going to look kind of weird, right? And so that's always an assessment I think we have to make. But the more I kind of do more tummy tucks, I just kind of steered away from those. I just feel like I wasn't getting great results that I could get with a standard tummy tuck. And so for me, a standard tummy tuck would be going around the belly button on an outer level of the skin, diastasis repair the whole way down, right? Pulling the skin. I think I get better consistent results for me. So this patient that came to me had been to another plastic surgeon and had at that point a mini tummy tuck with the belly button float, a revision to that, a conversion to a full tummy tuck with lipo and all these other things. So by the time she came to me, she was like a tummy tuck cripple. I don't know if you want to call it that. Her scar was very straight across, like all the way around, and then dipped down because it was so low that it kind of hooked down by the thighs. That lateral thigh tension pulling it down. Couldn't really do anything about that. The skin was super tight. She had been lipoed a few times, so there was literally skin on muscle fascia. So there's no, it's just flat, right? And then her belly button, because it had been floated and then cut around the surface and moved down, it was off-centered, like literally off-centered, and sitting about 2.5 centimeters from her horizontal scar at a level barely above her pubic area. So the belly button was just and it was flat. It just looked like a stuck-on piece of skin, no definition. And then on top of that, there was like scar tissue around it. There was like a bulge because they had left some fat to try and give it some depth, And then there was a potential hernia. So this case, I was just like, oh my gosh, like I've never seen anything like this.
This is one of the ones where I'm like, I want to take pictures and I'm going to think about it tonight. Then I'll call you tomorrow with my game plan.
I literally reached out to Dr. Hoyos, Alfredo Hoyos, who's a world-renowned plastic surgeon out of Colombia. Who's now,
and the belly button guru of like the world.
Yes. I mean, he literally removes your belly button to make his own because they look better.
It's better. Yeah. It's better than what God gave you.
Yeah. So, and he is the nicest human. I reached out to him. I asked the patient for permission. Can I talk to a surgeon about this? And I had a plan. I gave her my plan. I said, look, I think we need to do this in 2 stages. I think we need to give you some depth to your abdomen first. And we need to get rid of your belly button. And this is going to sound weird, but we got to cut it out. Gone. And we're going to make that scar as thin as possible so it looks like a little vertical scar. Now it's a little off-centered, but we'll do that. We'll laser it. We'll treat it so you can't see that, right? And then I will fat graft you. So I told her I would fat graft her all along her rectus abdominis muscles, all down the lower area to start to build up some thickness because she had no depth. And I was telling her, if we just cut some skin right now and did that, it would just look like you had this flat belly button. So I'm like, you need depth. And so I talked to Dr. Hoyos, sent him photos. He's like, yeah, I think your plan's great. I would do that. And I told him I wanted to use his H-wing technique. And he said, that's great. Here's some videos, super nice. So we did the first stage, took out the belly button. Just the act of me cutting out the belly button and trying to get that skin, that thickness, scar tissue out, that skin almost like necrosed. Like the blood flow was so bad that first surgery, it was like pale. I was like, oh my gosh, like what did I do, And luckily she was fine. The fat stayed really well. And then about 6 months later, we came back, fat grafted her again. But when I went to cut...
Oh, second round.
Second round, yeah. She retained fat pretty well the first round, but she needed, that's how much she needed. She just had nothing there. So I came back, grafted it again, and then I cut the H-wing belly button out, and it looks so good. She's so happy.
Must be amped.
Yeah, and that it's like one of those cases where you do that, and it's rewarding for you as a surgeon because you're like, man, like I went into this like I've never seen this. I know some tools. I know some people. I think I can put a good plan together, and then to have that patient trust you, like, let's do this. Like
you're like, I have never done this before, but here's the plan that I've enacted. And brought together.
So it worked out. She's feeling great and looking good. Yeah, man. How about you, dude? So how about share? Let's hear yours.
Well, for your story, I think this is actually super important. I think this is something that's like one of the amazing things about plastic surgery that people don't necessarily know is that plastic surgery, we don't necessarily learn techniques, right? It's like how you learn to take out an appendix. Like I have learned how to take out an appendix and I will just take them out like this.
There could be a factory
Forevermore. But it's all about figuring out what your goals are, knowing what the tools and the arsenal is, and then figuring out an effective game plan to make that happen. So you can come from a totally like unknown, patient with very specific goals and like get them there with a plan that is like maybe never been enacted before, but you can come up with something that's going to make sense and actually get you there, which is like so unbelievably special to like our specialty. And I love that when somebody comes in with just like a weird problem, I'm like, wow, that is totally something that I have never seen before. But based on my knowledge of plastic surgery, it's like, I'm going to come up with something that's going to work. And that's just, it's fun.
It really is.
Scary. Super scary, but it's fun.
But you trust those fundamentals that you've learned, those principles, those tools that you have. And I think, you can definitely execute, and
the reconstructive ladder.
Yeah.
As we all learn in residency.
Yeah, it applies even through, aesthetic cosmetic surgery for sure.